Hello, and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. February is Cancer Prevention Month. According to a recent global study published in BMJ Oncology, the number of adults under 50 worldwide being diagnosed with cancer has surged by nearly 80% in 3 decades. Here in America, the American Cancer Society reports that cancer patients are shifting from older to middle-aged people, with cancer incidence rising among adults under 50. What's going on here? What's causing this steady increase in middle-aged cancer rates, and what can be done to reverse this trend? We'll answer those questions and talk about how you can prevent cancer with Dr. Nour DaBoul, a hematologist and oncologist at the WVU Cancer Institute. Welcome to Live Healthy West Virginia, Dr. DaBoul.
Thank you. Thank you for having me here. It's my pleasure.
We're happy to have you here too.
Thank you.
So let's start here. I mean, this is an alarming trend, I would say, at the least. Are you seeing this trend in your patients with an increase in cancer cases under 50?
Yes, unfortunately, I do. I'm seeing this trend of having patients younger and much younger than 50 years old in my clinic. And it's not only my clinic, it's other clinics too, because I mainly treated GI cancers.
Wow. Are you seeing a higher increase in particular kinds of cancer, like pancreatic cancer or breast cancer?
Unfortunately, it's in multiple cancer types, but mostly it's seen in colon cancer, pancreatic cancer, liver cancer, breast cancer, and kidney cancers.
Wow. So what do you what's going on here? What do you think is causing the cancer rate in those under 50 to go up, but it's not increasing in those over 50?
Mm-hmm. It's definitely multiple reasons. It's not one.
Yeah.
And it's multiple factors together adding to it. I like how they worded in lifestyle. It's not only one thing. It's the diet we eat, the highly processed food we eat. It's also like how much our lifestyle has been more sedentary, like, not only shopping online, working online, working from home. After COVID era, you can see how much decrease in our activity level. Even now, children are playing their games online. All has been online, which is decreasing our activity level, and that has been correlated with increased incidence of cancers. To the point of the 50 years old and be like less or more than 50 years old, there are multiple things. Like, for example, increased alcohol consumption has been much more compared to 1950, for example.
Really?
And in like surprisingly, sleep deprivation. So adults' sleep time has been similar, but if you look at the children's sleep time, it's much less these days comparing to a decade ago. So our children are getting less sleep time, which is correlated to higher incidence of cancer as well.
Sleep and cancer.
Absolutely.
I didn't realize that connection was a thing.
Yes, we have to pay attention for our children, really, not only like activity and diet and healthy food, but also sleep.
So it almost sounds like a perfect storm to create this increase in middle-aged cancer rates.
Yes, and that would explain the numbers you just mentioned. Like it's 80%. It's a huge number, scary number, I would say.
That is a scary number. Well, it is Cancer Prevention Month. So what are some things we can do to prevent getting cancer?
Yeah, so back to some of the reasons we mentioned, of course, healthy diet, healthy weight, decrease like processed food we eat, increase activity as much as we can, decrease or eliminate alcohol consumption, try to decrease or minimize the amount of direct sun exposure that may be correlated with some skin cancers, and also sexual transmitted disease. So follow all the good guidelines we have to decrease sexual transmitted disease, and of course be up to date on cancer screening, which is very important.
And there just seems like there's so many cancer screenings, Yes. There are, but I mean, which is a good thing, because we can know what's going on.
Correct.
So let's talk about these screenings. I mean, they are the key to cancer prevention, right? Early detection makes a difference.
Absolutely.
So let's just start with the general population. What screenings should every woman get, and around what age?
Right. So each one of these subtypes of screening has like an age to start, what to do, and how frequent.
Okay.
And that will be different. And there is no way to mention all the guidelines because some guidelines are different from others, but I would encourage each one to kind of discuss with their primary care providers about what to do. But in general, like cervical cancer, which is one of the best screening outcomes we have so far, they start at age 21 and they need to do a pap smear once every 3 years until the age of 30. Then after that, they have the option to continue what they are doing, which is a pap smear every 3 years, or pap smear and DNA testing every 5 years. And they can stop at age 65 or 70 years old. There are also some different guidelines to tell you when to stop. The other important cancer screening is breast cancer. That showed a very good outcome in decreased mortality and to decrease also the number of metastatic disease at diagnosis. And for the breast cancer, there is different guidelines. I would love to be offered for every woman at 40 years old or 45 years old with the different guidelines. They can do yearly or every 1 to 2 years mammograms. And again, we're talking about general population.
And, with the I think that it's becoming more common now to have a 3D mammogram.
Absolutely.
That's a more thorough test. Is that helping at all in, catching more cancers earlier? It
does. And it's not only earlier, it's in certain body habits, like sometimes the density of the breast tissue, the overall weight, the way they can even perform the test. So definitely it's helping and it's available at WVU.
Okay. All right, so let's talk about the men. Those are the major tests, major screenings that women need.
Well, they still need colon cancer and lung cancer.
That's right.
But those are common for both men and women.
Okay.
So you can use this as a common pathway for both of them.
Let's do all right, should we do the common pathway first? What should both men and women get?
Colon cancer and lung cancer screening. So lung cancer screening for those people age 50 to 80 years old, and they have been smoking, or they are smoking now, or they smoked till 15 years ago. So they did not quit more than 15 years ago. And the accumulation smoking amount is almost 20 packs per year of smoking. They can get yearly low-dose CT scan.
Okay. And what would you say to, because there are some people that think that, I quit smoking a long time ago. I don't need a screening, or I don't have family history of cancer. I don't need a screening. What do you say to those people?
Time-wise, they can stop or not to be screened if they quit 15 years ago. Like if you have a patient who quit smoking 10 years ago, I would offer him screening for 5 years. And when we hit that portion of like 15 years ago quit smoking, he can stop. Family history is not all that good to be determined for lung cancer screening. Those who never had family history of lung cancer, they still need to be screened.
Okay. All right.
And then the other cancer is colon cancer.
Yes.
And
the good old colonoscopy.
We have much better and newer tests too. I'm not going to say better because I'm a big fan for colonoscopy.
Okay.
But we'll talk a little bit in details about that. So colon cancer, different guidelines, either 40 or 45 years old. And it's for everybody, men and women. You don't have to have any family history or any risk factor. And the modality of testing is either colonoscopy every 10 years. So it's not bad to get once colonoscopy every 10 years as long as it's normal. Or the newer test was a FIT test, a fecal immunochemistry test. And it's much easier to be done because it could sometimes be a sample or a kit sent to your home and you send it back, you mail it back. It's not tough. You can do that once a year, or FIT DNA test once every 3 years. Okay. Other modalities, sigmoidoscopy, which is a little bit easier and easier prep than colonoscopy, with a CT colonography every 5 years.
Are those home tests like, what is it, Cologuard? Are they as effective as a colonoscopy?
For colon cancer detection, yes, not for adenoma. And the difference between them, adenoma is a precancer that can develop to be cancer. So in colonoscopy, you have an early detection and prevention. You decrease incidence because you remove the polyp, that adenoma, before it's transformed to be cancer. FIT test is as good for screening, for detecting cancer, but not to prevent cancer from happening. But in my opinion, for my patients, what I tell them, the best test for you is the one that you will be adhered to, the one that you're willing to perform.
Better than no test at all.
Exactly. So if early detection is very good, and it still decreases mortality in cases of some very early cancers can be treated with surgery or like some endoscopic resection, and that may prevent lifelong chemotherapy, for example.
Okay. I know that pancreatic cancer and liver cancer are common cancers. Are there screenings for those kind of cancers too?
There are screenings, but only for high-risk patients. Those who have family histories and genetic mutations in their blood, but not for general population.
Okay, so we've covered the screenings, most of the screenings for both men and women. And
the only left one for men only is the prostate cancer screening, which was very common previously. Most recent data will not encourage screening for normal average risk. Those who don't have symptoms, family history, or anything else, you don't really have to screen. But for high risk patients, you can do yearly PSA test, which is an easy and available blood work. And it's usually age 40 to 70.
Okay. And if you're not sure, talk to your doctor, right?
Absolutely, 100%.
Okay. When in doubt, check it out, right? Okay. Now, you were talking about, what about people that have a family history of cancer? Now, should they be screened more often or earlier, or both?
Both, and sometimes it's a different modality. We can't cover all cases, but I'll give you some examples. Like a female patient who has a family history and a genetic mutations like a BRCA1 mutation, which is common in breast cancer. They may need to start screening earlier, 40 years old, or 10 years earlier than the first degree relative with the cancer. They may need to repeat it more frequent, and they may depend on MRI breast, not only mammogram breast. Same thing for colon cancer. Those who have Lynch or family history or genetic mutations, or at least family history of first degree relative, they have to start 10 years earlier than the family member. If a father of the current patient getting the prevention had a colon cancer at the age of 42, the son needs to be start screening at the age of 32. And they repeat colonoscopy every 5 years, not every 10 years. Same thing, you mentioned liver cancer, gastric cancer, pancreatic cancer. Each one of these examples have a screening for those who have family history and genetic mutations.
So you can be proactive about this. And
absolutely, you should be. You should be. What we're seeing of increasing number of younger patients, it's heartbreaking. And yes, we should do our best to try to prevent as much as we can, or at least early detection.
Yeah. Now, you mentioned lung screenings and breast cancer screenings, and WVU Medicine has a couple of programs here to make those screenings more accessible. Can you talk a little bit about Bonnie's Bus and Lucas?
Absolutely. Bonnie's Bus is a mobile program for mammograph, for like breast cancer screening, that has been started in 2009 with a very generous donation. And they usually go all over West Virginia for those areas, the rural areas that don't have an access as easy to go to and get mammogram that often. Since 2009 till now, they performed more than 30,000 tests, and they early detect a lot of cancers.
Wow.
And it's good for those who have Medicare, Medicaid, and also those who don't have any health insurance. They still can be considered through the donation program for that one thing. It's really an honor and pleasure to have such a thing here.
Yeah.
Lucas is very similar mobile screening test, but for lung cancer.
Okay.
For like a yearly low-dose CT scan. It also travels through 42 almost counties at West Virginia. And same thing, they depend on Medicare, but also donations are there for those who don't have insurance. So please, for anybody, regardless of your insurance status, just go ahead and ask for these services.
And you can either check with your doctor or check online. What the schedule is.
Absolutely, yes.
I know they travel all over the state.
And those who are not so familiar of checking online, just call WVU Medicine online. Just call that number and they will connect you to the right team.
Okay, good to know. So, tell us about the expert team at the WVU Cancer Institute and how we don't have to leave the state to get world-class cancer care.
Yes, you don't.
It's right here. Can you tell us about that?
Yes, it's right here. And we do have multidisciplinary teams for most of subspecialty cancers. Like there is a specific team for lung cancers, colon cancers, pancreatic cancers. You will be seen by multiple providers in different subspecialties for your cancer. We do have, as we just mentioned, not only good screening tools, but also a lot of approaches, like for example robotic surgeries, liver-directed therapy, liver pump, which not a lot of centers in the States would offer it. So yes, they don't really have to leave, and they have an access to a lot of clinical trials here, which is the best care they can get. And if not, we also have a combo match trial. For example, if you have a patient who has a certain mutation, we can search for a trial and open it for them in a very short period of time.
Wow.
So they should find that here, and if not, we'll be able to connect them with where they will be able to have it done.
So it's right here in our front yard. We don't have to leave West Virginia to get good cancer care.
Yes.
Great cancer care. Okay. So are most of these screenings we've been talking about, are they covered generally by insurance?
Yes, most of them are, and we mentioned briefly different guidelines, so each insurance may follow certain guidelines. We all depend on ACP a lot, but also other guidelines. So Medicare, Medicaid, and private insurance usually covers. They sometimes would prefer colonoscopy, not CT colonography, but you would get the screening, the good screening that did show to decrease mortality or metastatic disease.
Okay.
So yes, they are almost always covered.
Okay. All right. Well, before we go, I always like to ask, what is the most important thing you want our viewers or listeners, because we have both, to know about cancer prevention? What's the most important thing?
I understand that no one wants to know that they have cancer. And you try as a defense mechanism, I don't want to screen because I don't want to know. But treating patients with cancer, I really encourage you all to try to get the best screening. It's much easier and affect your and your family life to get to know early that you have cancer and to treat it with a simple procedure compared to a spread disease that you need a lifelong treatment that may affect your life. And as what we mentioned for colonoscopy, you have colon cancer screening and cervical cancer screening can decrease incidence of cancer. You can treat the lesion before it becomes cancer. It's not only early detection, it's actually prevention. It's decreasing incidence of cancer. So I strongly encourage them to do so and to talk to their primary care to know if they are eligible for screening and for what cancers.
Okay, good to know. Well, Dr. DaBoul, thank you so much. I mean, you gave us a wealth of information here. We know everything there is to know now about cancer prevention, which is very appropriate for Cancer Prevention Month. Thank you so much.
Absolutely. Thank you so much for having me here.
All right, great. That brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about cancer prevention and screenings, you can always visit wvumedicine.org/cancer. And to find the latest episode and all of our episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast. I'm Mary Ravazio Menard, and on behalf of Dr. DaBoul and everyone at WVU Medicine, thanks for joining us.